Hello, my name is Kat Thorn and I'm a Health Promotion Officer at a community health service in Victoria called Merri Health. Today I'm here to talk to you about an initiative called ReadySetPrep. But what is it? ReadySetPrep is a collaborative approach to improving school readiness for families and children in the northern suburbs of Melbourne. Before I get into the details, I'd like to start by acknowledging that we're meeting on the lands of the traditional owners during this virtual conference. For me, that's the lands of the Wurundjeri Woiwurrung people, and I would like to pay my respects to elders past and present, and also to any community members that may be joining us today. ReadySetPrep commenced in 2017 as a 4-year initiative funded by philanthropic organisation the William Buckland Foundation. This was through their Enabling Education grant and was complemented by integrated health promotion funding through the Department of Health and Human Services. The initiative is set in Fawkner, which is in the northern suburbs of Melbourne, about 10 to 15 kilometres from the CBD. I'm just going to briefly touch on the demographics of Fawkner to set the context of how and why ReadySetPrep is based in Fawkner and why the initiative focuses on school readiness. Communities in Fawkner experience high levels of socioeconomic disadvantage, with Fawkner rated as the 28th most disadvantaged suburb in Victoria. Of the nearly 15,000 people that live in Fawkner, nearly 65% of the population speak a language other than English at home, and almost 50% were born overseas, with just over 30% arriving in the past 5 years. The suburb of Fawkner is culturally and linguistically diverse. I'll just point out that Fawkner has an ageing population of Italian and Greek communities, but much of the work we do with children and families in Fawkner is with newly arrived families from Pakistan, India, Lebanon and Nepal. So along with these demographics, there are also concerning statistics relating to educational outcomes in Fawkner. This slide shows figures from the Dropping Off the Edge report, and as you can see, areas with higher numbers face greater educational disadvantage. Fawkner ranks highly across multiple areas, including 632 for numeracy at Year 9 and 637 for young people leaving school before age 15, which is equivalent to the bottom 2% of areas. As you can see, in 2015, the Australian Early Development Census showed that 37% of children in Fawkner were starting school developmentally vulnerable in one or more of their physical, social, emotional, language or communication skills. This was a much higher percentage than the 21% of children in the local government of Moreland who start school developmentally vulnerable, which is similar to the state and national average. These results provided compelling evidence to implement a whole of community school readiness intervention to improve educational outcomes in Fawkner. This is because we know that early childhood inequities impact long-term health, well-being and life outcomes, but we also know that intervening early can break the cycle of disadvantage. It's a big area to tackle, so it was hard to know where to start. But there was already an existing working relationship with the schools from past health promotion activities on healthy eating and physical activity. However, a collective impact approach with schools working together was new. Merri Health took on the role of backbone organisation, and with the primary schools as partners, an application was successfully submitted to the William Buckland Foundation to address school readiness in Fawkner using a place-based approach. As the scope of the initiative widened, so did the settings involved. Initially, ReadySetPrep looked at the transition processes for children as they moved from kindergarten to school, so kindergartens needed to be included as partners. We also acknowledge that school readiness and supporting early childhood development begins well before school, so we shifted the focus to families with children aged 0 to 6 years. Therefore, other early years services and community settings such as maternal and child health, libraries and playgroups became involved to overcome some of the barriers that children and families may face. There are now over 20 partners involved. All of the resources, key messages and local solutions that have evolved from ReadySetPrep have been co-designed with stakeholders and community members to specifically address the challenges or barriers faced by children and families in Fawkner. There is therefore a real sense of ownership over the initiative, particularly from our schools, kinders, early years and community settings that are now involved. We will now go through the ReadySetPrep model and how it has also evolved. The ReadySetPrep backbone team has always had 2 staff solely dedicated to the project. However, this has looked different at various phases. There has always been a health promotion officer dedicated to driving the long-term partnership work with schools, kinders and community and early years services. In the early days of the project, this was complemented by a family engagement officer who visited these same settings to develop relationships with Fawkner families. Families could then access information, resources, advice, and referrals. However, over time, resources were moved from direct service delivery to a systems change model to increase the sustainability of the initiative. A second health promotion officer was added to support this high-level strategic focus and the development and strengthening of further partnerships. In the current iteration, one health promotion officer is accompanied by a community engagement officer as we increase our focus on co-design and community-led and driven initiatives. We also have support from the team leader as well as other staff to assist with the delivery of short-term targeted interventions and trialling new approaches, which I'll elaborate on later. In terms of funding, we were successful in receiving $130,000 annually over 4 years from the William Buckland Foundation. This is complemented by funding from Merri Health's Integrated Health Promotion Funding, which is received from the Department of Health and Human Services. It should be noted that the limits of relatively short-term funding in a long-term initiative has been a key challenge and has resulted in turnover of key staff. In the past 9 months, ReadySetPrep has reformulated the governance. This includes a steering committee comprising of parents and service providers and a transition network for networking and professional development opportunities. On the screen now is an illustration that we have developed to explain ReadySetPrep's new governance structure. As you can see, we have the steering committee sitting up the top as it guides the strategic direction of the initiative. This is made up of 3 parent representatives and 9 organisations, including council, kindergartens, schools, and key local service providers. From this to the right, we have working groups, which will focus on specific priorities and are flexible in their purpose and duration. Members of the working group can include members of the steering committee, community members, or service providers. To the left, we have the Transition Network. This commenced in 2020 with 30 to 40 Fawkner service providers attending each term. In 2021, this network will be co-chaired by Moreland City Council to increase the sustainability and the reach of the network, with all services across the municipality invited to take part. In the middle, we have Merri Health as the backbone, with our main purpose being the facilitation of the ReadySetPrep partnership, as well as evaluation and communications. We also work with community on community-led initiatives and hope to have a greater focus on this moving forward. The work of each group contributes to a collective impact approach, with local organisations aligning their practices to support more children and families in Moreland to be school ready. For the first phase of ReadySetPrep, or RSP 1.0, we had some process and qualitative and quantitative measures that we were aiming towards. This includes to improve AEDC outcomes, share key messages, improve satisfaction with transition programs, establish a transition network, and extend transition programs. We are currently reflecting upon these outcomes and undertaking a co-design process facilitated by Clear Horizon to determine the new vision with community and service providers. To help us work towards these outcomes, we had identified 8 key strategies that are interrelated and guiding our activities. You can see them here, and we also outline these to our partners so that they know what they are becoming part of. We have had a focus on celebrating small wins as there are many moving parts to the project, and also some elements of the initiative have been large, which means small steps are important to keep momentum high and sustained. This has seen a focus on sharing key messages such as publications on the Prevention Health blog, presentations to Department of Health and Human Services and Department of Education and Training, as well as a case study for the AEDC website. We've also been involved in advocacy, and we've seen that the partnership was highly commended at the Moreland Awards and shortlisted at the Victorian Early Years Awards in 2020. Some of the key elements and achievements that utilise a combination of these strategies on the screen include the development of partnerships as outlined, including kinders, schools and early years services, the establishment of a new transition network, which was suggested by schools and has evolved to become municipality-wide, and it's continuing to grow from the 20 people that we saw at the first meeting. A professional learning day was organised based on the identified needs of our partners. All schools have made changes to their transition programs, which was supported by a mini grant program. These program extensions and improvements resulted in a 23% increase in family satisfaction with programs from 2018 to 2019. A morning tea was held in 2019 with 15 service providers attending the event. This provided an opportunity for families to learn about and engage with local services. And the development of an informative and educational video series and illustration detailing the importance of early childhood learning. The videos are a really tangible community-facing resource, so I'd like to go into this a bit more. We were able to work with a local social enterprise to film 6 videos in 12 locations with 73 people over 2 days, and in total over 200 people were involved in the co-design, filming and refinement of the videos. As it turns out, the timing of these videos was really great. Because it is quite resource intensive, they were filmed in 2019 and edited for release in 2020. This therefore saw a virtual launch during COVID-19. Given that there were topics around everyday learning and life readiness, they were appropriate during remote learning in Victoria. They were also reshared towards the end of the year, as there were videos about starting school, including a window into the classroom, which helped when children couldn't visit their new school in person. The videos now have had nearly 3,000 views across the series since the launch in May and June, and further, the algorithm also says that when looking at total shares, engagements and views, they have reached over 13,500 people. There is also an accompanying Journey to Primary School poster for the final video that can be downloaded from the Merri Health website. It is also available translated into 6 community languages, being Arabic, Bangla, Hindi, Nepali, Pashto and Urdu. The virtual launch also helped to build our social media presence and strategy, and it also helped families to become familiar with ReadySetPrep either through participating or watching the videos, and there's a real sense of community ownership. The videos were then recognised with a Victorian Multicultural Award in 2020. While ReadySetPrep is working on large system change for widespread impacts, this is coupled with targeted interventions for those experiencing particular disadvantage. These interventions address ReadySetPrep's aims and objectives in the community and are part of the collective impact approach with partners contributing with their own efforts and resources. So the first one is Wordplay, which started as a collaboration between Merri Health and Moreland City Libraries. It was piloted in 2018 and is now ongoing as a part of normal library programming. It is a dynamic English literacy learning model for adults and preschool children. The pilot showed that it increased library memberships, helped parents' confidence to read or speak English, changed how they read books to their children, and that children felt more school ready. There were also social connections developed, and Wordplay won a Victorian Early Years Award in 2019. LEAP, or Learn, Engage, Appreciate, Play, is an educational group for parents and carers of children aged 2 to 4 years old with additional needs. The project aimed to connect participants with other parents and carers in the Fawkner community and increase their knowledge about services and resources that can support them in their parenting. From the pilot, there was an increase in the number of people that participants could turn to for support, an increase in confidence in accessing services, and an increase in confidence talking to friends about the additional needs of their child. Due to the success of the first program, we are now running a second program. And finally, Sooner or Later was a responsive research project to explore anecdotal information we had heard from partners. This research looked at the tendency for children to start school early at first eligibility, so age 4 turning 5 rather than 5 turning 6. The research confirmed that children are starting school earlier in Fawkner and that they are more likely to start school early if they have a language background other than English or additional needs. Focus group data told us that this is because parents perceive school as a place where they can receive better access to support. We also requested disaggregated AEDC data, which told us that children starting school at first eligibility are much more likely to be developmentally vulnerable when they start school compared to those starting at second year eligible. So this was respectively 31% and 15%, which is a big difference. This data is helping us to see a larger picture and to design the next steps for our partnership work. This highlights that ReadySetPrep is evidence and data driven, with data playing a role in the monitoring and evaluation of ReadySetPrep, as well as the current co-design. We have therefore established systematic evaluation and monitoring systems, including tracking long-term data such as maternal and child health visits, kindergarten enrolments, as well as requesting disaggregated data by sex and language background from AEDC, as well as NAPLAN. We have also developed our own bespoke tools as a gauge of school readiness of the class based on the AEDC. We have quite a comprehensive data package now and are also busy developing data dashboards that help track staff and family feedback, accessible by us and the schools. We have also coupled hard data with community stories and recently undertook a most significant change process with our steering committee. We've also had 150 community conversations to feed into the planning process. Additionally, we have made an attempt to incorporate child voice into our planning by inviting children to make videos, offering advice to new preps and hearing what makes them feel happy and safe. So looking at quantitative data, over 3 years we can see that there has been a significant decrease in the number of children experiencing vulnerability from 2015 to 2018. This is great, but the level of vulnerability is still above the moorland level, so we know that there is more work to be done. From undertaking contribution analysis, we understand that ReadySetPrep has played a role in the improvement of these statistics, but it's alongside other factors such as early childhood programs by Melbourne City Mission and the opening of a new kindergarten, which allowed more local children to access early education. When we look at neighbouring areas, we can see that while Fawkner has seen improvements in those vulnerable on one or more domain, Glenroy has not improved, and in fact the statistics in this suburb have significantly worsened. This has recently prompted the ReadySetPrep partnership to expand our focus geographically across the whole of Northern Moreland. When looking at the data using weighted averages across Glenroy, Hadfield and Fawkner, we can see that families are less likely to visit maternal and child health, less likely to go to kinder and more likely to start school behind. There are also other indicators of disadvantage within the community, such as residents in Northern Moreland are less likely to complete Year 12, less likely to reach literacy and numeracy benchmarks in NAPLAN tests, and more likely to be unemployed. Given this, we are really excited to be scaling up to Northern Moreland. At the end of 2020, we were successful in receiving funding from the Helen McPherson Smith Trust for a further 2 years. This will provide us with $100,000 per year over the 2 years. Over this time, we plan to reach approximately 1,200 foundation students, their families, 13 schools and 17 early years services. Future student and family cohorts will also benefit from sustained changes to transition practices within local settings. In terms of the future, we are currently in the process of co-designing the new vision and theory of change with the steering committee and community members. It is hoped that this next phase will be partnership driven and result in an increase in the collaborative nature of the initiative, with community members and service providers taking responsibility for change in a strengths-based manner. We therefore anticipate some community-led initiatives, which the Community Engagement Officer will support, and more targeted interventions coupled with a proportionate universalism model. We will also take some of the frameworks and infrastructure from the first phase and carry them forward, such as supporting capacity building and aligning priorities with other organisations like Moreland City Council and their goals around maternal and child health and kinder attendance. To sum up, I would like to share some reflections with you. We know long-term change takes time and we've finished our first 4 years of funding, but we understand that in order to see true impact and change, we realistically need to double our time frame. The long time frame also means we are able to learn by doing, allowing the intervention to emerge over time, rather than planning the work and working the plan. Because it is long-term work, we also acknowledge that we need to make an effort to maintain momentum, which is why we have placed strong importance on celebrating the small wins through awards and publications. This will in turn foster a culture of success and reinforces everyone's commitment to the long-term priorities of the project. The long time frame also means we are able to learn by doing, and we have reframed our perspective on the need for a linear plan, as the challenge we are addressing is what's known as a wicked problem with complex systems. And the more we do, the more we learn, and we've also been willing to make safe to fail errors while searching for what does and doesn't work. And finally, we've learnt lessons from COVID. We've adapted to online engagement for steering committee and transition networks, and there are adaptive practices that we will maintain post-COVID, such as stronger social media engagement and continuing to offer network meetings virtually. That brings me to an end of our summary of ReadySetPrep, so thank you for listening. Please feel free to get in contact with me as I'm more than happy to answer any questions or provide further information. Thank you.